name is Karen Collins.
And I'm Catherine Price.
We're two of the surgical nurse practitioners here at the Royal Gwent Hospital. Part of our role is to manage the virtual inpatient service, or as we call it, the VIP service. It's been running here in its current capacity since March 2017. However, up at Neville Hall Hospital, it's been running successfully for the last 10 years.
So once a patient has been admitted via the emergency surgical take and seen by a senior doctor, and they're deemed well enough to go home, we can let them go home and continue their investigations as a virtual inpatient. It means they can recover in their own home.
Radiological investigations can be performed typically in 1 to 2 days. Throughout that time, if the patient needs to be reassessed, we can bring that patient back into hospital and carry out their treatment. Patients are kept informed of their ongoing treatment and results throughout the process, and the GPs are also swiftly informed of results as well.
We're used as a point of contact, so they have our clip numbers and telephone numbers so they can call us if there's any concerns throughout the process, and also when they're looking for the results of their scans.
Feedback from patients is positive and is anticipated that more and more patients will be managed through this service in the future.
It just means that we can reduce unnecessary demand for hospital beds, so that there is beds available for those patients who are sick that really need to stay in hospital.
Hi, I'm Sharon. I attended the Royal Gwent Hospital with some stomach pain. I was lucky enough to be able to go home, so I did go home that day and classed as a VIP patient. So following that, this meant that I had contact with the nurses who I could contact any time within that week while I was waiting for my scan. Fortunately, I had my scan within the week, but I was reassured that although things weren't quite right, I had the nurses on the end of the telephone. Following the scan, within 48 hours, one of the nurses contacted me, reassured me that everything was okay and that I could carry on as normal, but any further problems, don't hesitate to go back to my GP. It was an excellent service and I couldn't fault it.